hoping more people would join us. I don't know if you can.
Sorry, say that again.
I don't know if you can see who's on, but right now it's Dr. Kramer, Katie, you, and myself who are in the call. So far, that's it.
Okay, great. Do we want to wait a couple more minutes or just start going?
Well, we should probably wait a couple more minutes.
Okay.
But
Jay's supposed to be on, right?
No, I don't think so. Jay's on vacation.
Oh, yeah, that's right. Okay.
Yeah. But I'll ask Katie a couple of things. Katie, is Joey going to be here to talk about his project application?
Nope, he's traveling.
And so if there are questions, we would just write them all down and send them back to him for response. Okay. So on our agenda today is updates on our 3 subgroups, implementation groups. And the 2 leads for 2 of the groups are not on the call today. So
that's why we have you here, Shelley.
You call that leading from behind.
That's right.
Yeah. That's
Swift
right.
kick in the rear end.
Well, I can go ahead and start with the Just Walk updates if you want me to.
Yeah, let's go ahead and do that.
Okay. So we had previously been walking the second Saturday of every month at Pearson Park in Wyandotte County, Kansas. However, due to lack of community engagement, we have decided to put that walk on hold for now while we are looking at a new walk site. So we discussed this at our last Just Walk meeting, which meets once a month. And we had decided to try Antioch Park as our potential site. So we are currently looking at that option and going to investigate maybe some best times for that, as maybe Saturday isn't the best time or date either. So as far as that walk, it's currently on hold for the next couple months. We probably wouldn't start that next walk site until September, I'm guessing, kind of after school starts, and then time and date to be determined. Our second walk site is at Harris Park. That's in the Ivanhoe district, and that will start, well, tomorrow. I'm going to be leading that walk at 5:15, and we're hoping to get some of the parents involved who are there for their kids' activities. And so that will take place every Wednesday from 5:15 to 6:15 for the next, what is it, Shelley? Is it 4 or 6 weeks?
4 weeks.
I think 4 weeks. Yeah, 4 weeks. So that is our second walk site. And then on top of that, there are some potential community partners who are also starting up walks or interested in collaborating with us to start up walks. Anyone have any questions about that?
I have what might be a suggestion. The first is a question. Are you guys familiar with Columbus Park east of the city market?
Is that in Kansas or Missouri?
It's in Missouri.
Sorry, I think we were looking for a Kansas site. That's why we had stayed on that site, but we're always open to more suggestions. So yeah, that's something we could look into.
Well, it's a nice little park. They just have a couple of small shelters, but it's very attractive, I think, and it has a very nice view. It's just north of I-70, just north of downtown Kansas City, and fortunately you cannot see the interstate, I don't think, from there, but you can see over the interstate to the downtown skyline looking from north to south. And it's just a nice little park, and I think they've developed quite a nice community from what I can gather. There was an event there just a couple of weekends ago for Asian American and Island Pacific group that I stopped by. Just it sounded cool, and I like that area. And I think it was well attended. I think it might have been their first one, maybe their second one. So, and I think I get a feeling there's a really nice neighborhood feel there. I've seen advertisements for a coffee shop called Cafe Cafe. And anyway, if somebody's interested in looking for a venue on the Kansas side, my guess is there would be some interest there.
Yeah, okay, wonderful. Thank you for that suggestion.
You bet.
Maybe if you could drop it in the chat, just so we have it
Oh, sure.
in our notes. Thank
Looks
you.
like Katie just dropped it in there for us.
Oh, perfect.
I've been
Magic.
to Columbus Park a few times. They also do geocaching. Like there's a bunch of site locations for that at Columbus Park.
Oh, cool. Anyone
we
have any other
found-
questions before we move on? Oh, go ahead.
Yeah, what we found, Ed, is that if we go to a location that hasn't already been determined by someone else as a place that's either has a high traffic or lots of people using it, it's really difficult to get the word out that we're hosting these activities. And
Right.
so over about a year and a half, the max we've ever had at a walk was five actual participants. And when I say actual, I mean, it doesn't include the healthcare lead, the volunteers, and the kids they brought with them.
Okay, sure.
And that was only one event. That wasn't all of them. And so that's,
Right. Well, I would think it would be difficult to kind of get something like that rolling and then, maintain some momentum and growth. I would think it would be very challenging.
Yeah.
What they don't have right there in that park, I believe, is actually like a community center. There's another park that I just recently discovered. I was looking for places to take my medical students on a picnic a while back, and love Children Mercy Park, and love Loose Park, and we've gone to both of those. But another one that I looked at that has a community center, now that I recall, and I'm not sure I'm going to come up with the name, but it's just north of 39th Street, not quite to the KU Medical Center as you're going from east to west.
Yeah, I think I know what you're talking about, but I can't remember what it's called. Does it have like a
Park.
zip line?
It's
What'd you say,
Roanoke.
Kate? Roanoke,
It's
that's
Roanoke
it.
Park.
Yeah.
Yeah,
I know
Roanoke,
that
That's it.
yeah.
is.
So I think the attraction there might be there's a community center, so they probably have a certain amount of draw of people. I will say that I hiked on one of the trails, and there were some small homeless encampments of maybe 4 to 6, little bedrolls and things like that. So I felt
Mhm.
a little uncomfortable being by myself, in that,
Yeah.
like I was in danger, but I thought, well, my students might be uncomfortable if I brought them here. So, but that was just on one particular trail. I think there are probably plenty of places to walk.
Yeah,
well,
that's been a little bit of the challenge too, is trying to find something that has an indoor possibility for the winter months as well.
Oh, right.
Mhm.
if you get a chance, Ed, we'd encourage you to check out Harris Park with your students.
And that's on the Kansas side?
Missouri.
Where's
Missouri,
where is
like
that? I might have checked.
55th and gosh, what's the cross street? It's fairly close to UMKC and Children's Mercy.
I know I've been there. I just can't.
It sits within a neighborhood. They have a 3-hole golf course, some playground equipment, a walking path, and then connection to the neighborhood. They do have it's a small, I hesitate to call it a community center, but it is an enclosed, it's like a garage, essentially. They have some programming within there, and they have an office or
It's within like the Ivanhoe district, so Young Family Farms over there. I want to say the address is 1604 East 41st Street, if that helps at all.
Yeah, I'm looking at the map here, and anyway, yeah, I'll check it out if I haven't been there. This year we ended up, because it always drives me a little crazy if I plan something outdoors and I don't have an indoor backup. And then there's always that, threat of thunderstorms
Yeah.
on that day. So we ended up renting the large shelter at Loose Park. Dr. Ellison was there because she's another docent, year 1 and 2 docent at UMKC.
Well, so our contacts at Harris Park could make arrangements for the indoor location to be available if you were interested in
Oh.
going out there.
Cool.
So with that, we continue to align with other walks that might be taking place around the city, but it seems that as little ones get started, they don't maintain enough interest and they sort of fizzle away. So there was one going on at Lakewood that was led by, I think, Meg Gibson. You probably
Right.
know her. Yeah, and
Sure.
it seems that might not be going on anymore.
Oh, okay.
And KU Med had one, and it doesn't seem that their walk is happening anymore. So I'm assuming that's primarily, it's driven by two things. Number one, interest, and then number two, lack of volunteer coordination and leading it.
Yeah. Well, here's
So-
another thought, and this goes against the grain of all of us who like to be outside, but there are mall walkers. And that there are, those folks are already going to the mall to go walk around the perimeter. But you might throw in a little bit of, education and that sort of thing. Maybe you can form a group for something like that.
Certainly
as
always an
interesting.
option.
Yeah.
Yeah, so we're just trying to find where's the best location with interest, people who are interested in hearing a little bit on a health related topic, and then convenient enough that we can get volunteers there to
Yeah.
lead it, to be the healthcare speaker.
It sounds like it has the potential for having a lot of investment and not so much return on your investment, just in
Correct.
terms of time and labor and. Yeah.
Correct. And this is outside of people's, what they're getting paid to do. They're doing it because
yeah.
they like it. And you can only show up so many times without other people showing up.
Right.
Anyway, it's still, we like both you and Dr. Ellison, we really think role modeling is an important value of ours as healthcare professionals. If we can't prove that we can do this stuff ourselves, how in the world do we expect to get other people to do it?
Right.
And so we continue to look for opportunities to make this happen and we can't do it alone. And so we have to align with anyone else. So getting the students involved is really fantastic. And I think helps with motivation and interest. And even if it starts as an educational component with students, how great would that be? And then just invite people in the community to join in whatever way that looks like. But anyway, any
Well,
ideas you have are welcome.
You mentioned students, and I know it's hard to get into the schools with anything that might threaten curriculum time, but maybe the school, most schools have some kind of PE teacher or something. Maybe they can become. They're already doing, health education, I would think. So I don't know if that would be something to partner with and give them some formal training or show up occasionally for their PE classes or whatever.
Well, we are considering partnering with a school to host this at a school setting.
Oh, good.
Yeah, so more to come as we find a school that wants to move it forward and support it.
Well, in that regard, I can tell you who has a lot of experience with schools and activity and underserved people is Bike Walk KC, and I know
Oh,
they're
yeah.
part of the group, so they would almost certainly know, yeah, well, this school would be a good partner, and that one probably wouldn't work out so much, and of course,
Yeah.
that's where I would go.
Well, that's good. That's a good thought. I hadn't thought about potentially partnering with some of their programming they have at schools for youth. We could do the same thing we're doing at Harris Park, engage the adults as the kids are participating in their bike education programs.
Mhm.
Okay. We'll explore that, see what opportunities there might be there.
Cool.
But this sort of segues right into our next update, and it's the curriculum subgroup of the healthcare sector. That's led by Dr. Jay Robertson. Do you know Jay, Ed?
Only on a couple of these Zoom calls, I
Okay,
think. I thought I
He's a-
might meet him last Saturday at the Kansas City Health Fair,
but except he's on vacation.
but except he's on vacation. Yeah, there were some other representatives from Children's doing sports physicals.
Well, we have been working to bring Dr. Jennifer Trilk to the Kansas City area. She is a professor in lifestyle medicine. So she has worked out of the University of South Carolina's medical school to develop lifestyle medicine curriculum, and is coming to Kansas City in August, where she will present a grand rounds hosted by Children's Mercy from 8 to 9 a.m. on Thursday, August 17th. And then we've been working with each of the med schools, so KCU, UMKC, and UMKC, to have small group conversations with Dr. Trilk about ways that she has found successful to embed lifestyle medicine in medical school curriculum. We don't have her exact itinerary, like I think KCU and UMKC are going to have small groups with her on Thursday. Oh my gosh, KU Med is going to host their small group on Friday. The grand rounds will be available to participate in virtually. So anyone who's interested, we'll be sharing that information with our healthcare sector. And if anyone's interested in participating in the small groups that are taking place at the different medical schools, let me know and I'll connect you with the right person at each of the medical schools. Now, you already know Dr. Ellison. She is the one who's coordinating for UMKC. If you were interested in other ones because you know people there as well, let me know. I can connect you with their coordinators as well.
I think for me, being at the UMKC one will be sufficient, and I hopefully can be there with Dr. Ellison. And although I do know a couple of students at KCU, you guys probably know a lot more, but who are members of the family medicine interest group there. And that, if you need some kind of a focus for making things happen, that's possible. So, those things tend to be kind of hit or miss, they're just students in general and excited. And then all of a sudden, reality sets in and you got exams and things like that.
So this is just the beginning conversation to think about how those medical schools can embed some of this curriculum into their current curriculum plan. And as you already mentioned, that's oftentimes a heavy lift. If you put one thing in, you got to take something out. And what does that actually look like? So again, this is just the first step. We hope to continue. The curriculum group meets on a monthly basis right now. Right now, we're planning Dr. Trilk's trip after she comes to Kansas City. Our follow-up is, we hope that our follow-up is getting these three medical schools together to learn from each other. One of the opportunities as you work to include lifestyle medicine at the different medical schools is establishing a lifestyle medicine interest group. from this with the students. And so if
Nice.
each of the schools can have an interest group with students, learning the different types of activities that are going on could be extremely valuable. I also think, and I only have experience with Dr. Ellison's model of doing this, but the service learning component could certainly be an opportunity for collaboration across institutions. For example, while we don't have medical students, or we don't have a medical school at Children's Mercy, we get students all the time. And Dr. Ellison brings students to the community garden as part of their service learning. They get to learn about growing food, access to healthy food, a new information and education related to fruits and vegetables. And as we expand, our plan for expansion in the garden is to have a teaching kitchen, an educational room, and provide both education from the gardening perspective, but also nutrition education as well. And so if we could have students participate from all of the institutions, now we're starting to increase opportunities for learning related to both the nutritional aspects of food, but also growing healthy food. So that's our hope as this group continues to move forward with the eventual plan to be embedding lifestyle medicine curriculum into medical schools and expansion to other health professional schools as well. So dietitians, pharmacists, public health, physical and occupational therapy, nursing, exactly. Because while some may have experience in different components, for example, dietitians are going to get plenty of nutrition, they're not likely getting much, if any, physical activity. What are they getting related to self-care? What are they getting related to some of the other components of lifestyle medicine?
Right. I like the sound of all of that. And I don't know if Dr. Angela Barnett has ever been involved in this group. You know
That doesn't sound familiar.
So Angela is a good friend of ours, and she's a colleague out at UH Lakewood. She's a family doctor. She has special training in integrative medicine. Very much about healthy foods and active lifestyle. She incorporates that into the Sojourner Clinic, the med student run free clinic. She's gotten so darn busy, it's just hard to even think about adding anything for her. But
yeah,
she also teaches for the med student connection. She's the course director, clerkship director for the family medicine clerkship, which is in year 4 of the 6-year curriculum for UMKC School of Medicine. She's the director, and she would have some possibility of maybe introducing some additional. I know they have some lifestyle medicine in there. I just don't know what it is formally, but she would know, and she would probably be interested in adding if there's any possibility something about lifestyle medicine. Of course, every time you do that as an instructor, you have to figure out where to put it, how to do it, who's going to teach it, who's got any time, get it approved by curriculum committee, all that stuff.
Yeah. Yeah. Well, that's where we want to align. That's one of the reasons we want to align with the with Dr. Trulk and the American College of Lifestyle Medicine, because they have developed curriculum. They have experience embedding this into and can answer questions from the curriculum developers, or I don't know, whoever's in control of that at the different medical schools differently than we can, because we don't have experience, like I'm not on a med school curriculum committee. And so that's where we think her expertise and experience with these different groups can propel this work forward versus what we would do what we could do on our own.
And another thought is been on a much smaller scale about UMKC School of Medicine, the PA program.
Yeah.
Where I serve as medical director. We only have 20 students per class. and the curriculum is absolutely jam-packed, bursting at the gills, you know. But they're all interested in that, you know.
Yeah.
And I know we get some of that. In fact, they just heard a talk several weeks ago, you know, about childhood obesity from our very own expert at Children of Mercy.
Sarah Hample.
Yeah,
Yeah.
and actually, there are lots of experts at Children of Mercy in that area. They realize. So that's an avenue to
Yeah.
consider as well.
Well, yes, and we agree. So, however we can pull those two things together, you know, let us know. And so I think the first step is these small groups at each of the different med schools. And so if you can participate in the one at UMKC, that would be ideal. So you'll get more information from us about those as we finalize the itinerary and the small group opportunities. So one of the things we want people to do is save the date. So August 17th.
Wait. And did you have a time for the small group one at
Not yet.
UMKC? Okay.
Stephanie's been on vacation and hasn't been able to respond. We just have the grand rounds. The grand rounds is from 8 to 9 a.m. on the 17th. And then the small group for UMKC will also be on the 17th. I just don't know if it's going to happen in the morning or in the afternoon yet.
Okay.
But as we get that information, I'll
So she's
communicate
doing the
with Dr.
Children's Mercy Grand Rounds, Shelley?
Yes, that is Children's Mercy's
Yeah.
grand rounds. Mhm.
Okay.
And so we'll communicate with Dr. Ellison, who will then communicate with anyone interested at UMKC. And so as I meet with her to talk about that, I'll make sure she knows to reach out to you, Ed, because I've seen a handful of people that she's been communicating with, one being Dr. Kamath. Another one is Katie something. Let me see if I can find the names. You may know all of them, or at least some of them. Katie Miner.
Oh, I actually just met her recently. Yeah.
Yeah. Katie Miner and let's see, there are a few others and I can't find their names right now, but
And she is a year one and two docent.
Is she?
So, you know, Stephanie knows everything about the med school, and so she would know, you know, where to potentially, you know, target year one or two, or you know, 3 through 5, or the year 6 students, of course, are all the way on rotations, 5 and 6 to a great extent. But some of those rotations, a lot of those rotations are in town, so they could still probably break away for certain things.
yeah, so whatever those groups can help us do to figure that out, or whatever we can do to help them find opportunities is great. Here, let's see. Michael Wacker is another one.
Yeah, he's a physiologist and an associate dean, I believe, and
Okay.
Yeah.
Okay.
very in tune with the curriculum as well.
So in conjunction with that, it's expensive to bring Dr. Trilk, and so we have some funding available through the physical activity plan to help cover those costs. The way we approach that is through what we call implementation project applications. And so this sector is going to be applying for funds to bring Dr. Trilk to Kansas City. In order to submit that application, we have to review it at a sector meeting. So that's this. And it's submitted to the core work group, and that's where the leads of all of the sectors come together and talk about what's going on across sectors. the school, and that group will score the application and then determine whether or not it meets the threshold for funding, and then we'll follow up to say yes or no, the funding is has been approved. So for this application, it's scored based on whether or not the strategies, whether or not the application aligns with the strategies and tactics of the healthcare sector, whether the project is multi-level, whether it's cross-sectoral, and if the next steps are clear in terms of how this would inform future efforts or would be continued moving forward, if that's the case. So this application, I'm going to review it with you all really quickly. I can either share my screen or Katie can drop a link in the chat to the application. Do you have a preference, Katie?
I shared the link, but I can go ahead and give
Oh,
you.
great. So the purpose of this is really to bring Dr. Trelk to give a grand rounds presentation on how to include lifestyle medicine in the core curriculum of the training of healthcare professionals with a focus on medical students. The title of her presentation is The Power of Lifestyle Medicine Training in Medical Education and Practice. And her learning objectives are to provide the rationale for provider training in evidence-based lifestyle medicine to use in conjunction with conventional medicine to prevent, treat, and reverse chronic conditions. The second objective, provide examples of needed training in medical education regarding lifestyle medicine mechanisms related to chronic conditions. And the third is to know what you can do to promote lifestyle medicine training as a clinician or an educator. This application aligns specifically with strategy 22 of the physical activity plan, and that is universities and postgraduate training programs and professional societies should include basic physical activity education in the training of all healthcare professionals. So this is exactly what this strategy asks us to do. In terms of being multi-level, we are looking at levels within a system. So the levels are individual, interpersonal, built environment, organizing/advocacy, and policy. For this application, it clearly meets the individual interpersonal because by embedding lifestyle medicine into curriculum, it would be educating medical students both on how to change their own behavior, but also the impact of behavior change related to lifestyle for their patients. For this project, we think it is also organizing and advocating because we are involving all three medical schools to include curriculum within their own settings and then use our momentum to learn from each other. I'm not sure that it really rises to the level of policy. So the two levels of the system that I'm suggesting this applies to are individual, interpersonal, and organizing advocacy, unless either you or Jody thinks there's a case to be made for policy.
Really policy at the.
Say that again.
Only if you're considered policy at the medical school level, but probably not higher than that.
Yeah, yeah. And so I feel like that might not be scored as well because it's sort of difficult to make the case. The application asks for what other sectors would be involved in this project. So for this one specifically, no other sectors are being asked to be involved in this project at this time, because right now we're just looking at embedding this into medical school curriculum. So it doesn't necessarily make sense yet in early childhood or schools or parks and rec. I think moving forward, as we get farther down the line with this plan, we would connect all of the sectors, and medical students would have opportunities to engage in whether it's role modeling or their own health behaviors in those settings. But I feel like that's a stretch at this time. So we're not saying it's multi-sector. In terms of the next steps, this is part of a bigger effort in the healthcare sector, where we want to align across the different groups of the healthcare sector. So the purpose of this presentation and small group meetings are really to share how lifestyle medicine curriculum can be embedded into health professional training, and to brainstorm and problem solve in small groups how to specifically do this in each of the medical schools in Kansas City. As this work progresses, it aligns with the Just Walk program that the sector also leads, in that the students can participate as role models or practice giving the healthcare presentation and connecting as they get into practice, connecting their patients to resources such as this. We think it also connects with the billing reimbursement, because as that group advances, providers are more likely to talk about things that they can get reimbursed for. They're more likely to be given the opportunity to do that by the institution within which they work as well. We think it also provides opportunities to connect with other sectors as students look farther down the line and both work on their own behaviors, but also identify opportunities within the community where they're serving to connect their patients to. The amount of funding being requested is $3,000. $1,500 of that would cover speaker fees not already covered by Children's Mercy's Grand Rounds. Dr. Trilk has requested $2,500 as an honorarium for the initial presentation. The $1,500 would, an additional $1,500 would cover, let's see, I think I'm saying this wrong. I did, let me back this, this group is requesting $3,000. $1,500 of that would cover small group meetings with each of the medical schools. So those are $500 a piece. It would cover one hotel night. So Grand Rounds covers one hotel night. We would have to cover an additional hotel night so that she could stay and provide the small group conversations. It would cover miscellaneous meals not covered by Grand Rounds. And it would cover an additional honorarium requested by the speaker. Airfare would be covered by Children's Mercy Grand Rounds. So we're requesting $3,000 to support bringing Dr. Trilk to Kansas City. Thoughts, questions?
Where would the grant come from?
The Kansas City Physical Activity Plan. So we, the KC Healthy Lifestyles Collaborative received a grant from the Sheeler, let's see, a foundation. Let me tell you exactly which one. The Enid and Crosby Kemper Foundation. So as part of that funding, we have money set aside for implementation projects. Each of the sectors has at least $10,000 to apply for funding, if that makes sense.
Okay, so it's actually applying to the kind of overall overarching Healthy Lifestyles Collaborative
Yes,
that has already received some grant money.
correct.
Okay. I think that all sounds great. And I don't think $3,000 is too much to ask for something like this that actually has great long-term potential, you know. Not just bringing in a speaker and putting them up in a hotel. There's a lot more to it than that. As far as the policy question, I agree that as it stands, we don't necessarily, this wouldn't necessarily impact foreseeably, policy on the local, state, regional, or national level. Although there are, you know, policy initiatives either in place or being developed that this could help add additional momentum to. So I wouldn't say we're going to be taking a new policy to some level, but there may be communities that are, you know, updating their complete streets policies, or this, you know, the state might be looking at their school lunch policies or something like that. I don't know that I would even mention that because wouldn't want to be held responsible for it.
Yeah. Right.
But I think that's where we stand, and I agree with what you said, what everyone has said, that this wouldn't directly address policy, and I'm okay with that.
Mhm.
The
Yeah,
only
what's
other
the scoring right now?
well,
What's the
it's
score at?
okay. So there are there are 4 domains. So I'll go through them one at a time. So number 1 is, does it align with KCPA strategies and tactics? You either get 0 points for no, 1 point for it aligns with some strategies, but maybe not a tactic. And you get 3 if it aligns with a strategy and tactics. And what I forgot to do is put in the tactics. It aligns with all the tactics in there. So it does align with
Yeah.
strategies and tactics. So we'd get 3.
Yeah.
Is it multi-level? So we just talked about organizational and individual. So that means it is
Mhm.
multi-level. So you either get 0 for no or 3 for yes.
A 3, yeah.
So right now we'd be at 6. Is it cross-sectoral? We said, no, it's not.
That's the hard part, yeah. Mhm.
Right, so we'd get 0 points for that, but our scoring threshold is only 7. I say only,
Mhm.
it's 7. The last section is, are there clear next steps that would continue this work? Your opportunity for
Yeah.
scoring is 0 for no, 1 for somewhat, 2 for yes. Even if the full group only gave us 1 point for that, we'd still meet the
Mhm.
threshold for funding.
It'll be a 7, yeah.
We'd get a 7.
I would agree. I would definitely say that we should support this. Obviously, we've been trying to get her for a long time. The group has worked really hard to move this forward. So I would definitely say yes.
Yeah. So far, I do think it needs a scoring threshold. I will,
Yeah.
again, with your permission, and because this is being recorded, I will update the application to be a bit more clear in our next steps, and make sure my funding request is very explicit in what I say. The funding amount is still $3,000, but I wasn't very
Mhm.
clear in how I said that money is going to be used. I'll make sure that it's clear in the application, and try to make sure I'm clear in how it aligns with what we're doing already and the vision that we are hoping to achieve longer term.
Perfect.
Okay,
Sounds great.
great. Well, I know we've hit the end of our time together. We do have another application that has been submitted, but since Joey's not here, we might hold that and review it in one of 2 ways. 1, send it out to the healthcare sector group to review and provide feedback, or 2, review it at the next healthcare sector meeting. And I can't remember when our next meeting actually is.
So we meet bi-monthly,
Yeah, I
so it's
don't
actually
remember either.
August 8th. But I feel like just because the outcome of this meeting, maybe there was confusion because we did reschedule. So do we want to go ahead and have a July meeting and get back on our normal schedule? Because that would put us at July 11th, because we pushed this meeting a month. We were supposed to meet last
Mhm.
month. So do we want to get back on our normal schedule and meet in July?
So let's see here. So Shelley, we present these quarterly to the core meeting, correct?
Well, we've actually We've increased, so we review these, we've already agreed to review these bi-monthly, so every other month. What I plan to bring to the next core work group meeting is the idea to review these on an as-needed basis, so that,
I see. Okay. So we don't have
It
to
will-
wait. I just didn't want to like hold
Yeah.
something up if something needed to be pushed through quicker.
correct, right?
Yeah. I would be fine with July 11th. I'm not looking at my calendar directly right now, but I
Okay.
can't think of anything at that time.
And
Yeah,
that
same
should
here.
work. That works for me.
Okay, then I will go ahead and make that update.
Okay.
Okay,
Will that be timely enough to further approve this, or are we officially approving this
We're
step today?
officially approving this one to move forward for submission.
Okay, great.
Then the other one, it'll give us time to review that at that meeting and then hopefully approve it then for review the following week at a core work group meeting to keep that moving forward and on track as well.
Okay,
Mhm.
awesome.
Okay. All right. Well, great to see you all. Thanks for
Thank you,
showing up.
Shelley.
You bet,
Thanks,
Jamie.
everybody.
Have a good day.